My eyelids are drooping again, years after ptosis surgery. What can I do?
Eyelid ptosis is a term to describe the eyelid position being lower than it should be. Surgery for ptosis is performed to elevate the affected eyelid or eyelids. I often see patients who've had previous ptosis surgery who are frustrated with needing to have another procedure. The underlying cause of the eyelid ptosis, as well as age and other factors, do affect the longevity of results after ptosis surgery. I'll discuss how I counsel my patients who come to me for ptosis evaluation. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I perform cosmetic and reconstructive eyelid procedures every day in my practice. This includes surgery for under eye bags, for hooded eyes, and Asian double eyelid surgery. Eyelid ptosis correction surgery is essentially exclusively performed by oculoplastic or oculofacial plastic surgeons, as it is specialized surgery which is focused on during fellowship training for surgeons who completed residency in ophthalmology. As is the case for any surgery, people who come in for ptosis surgery want the procedure to be done once and be good for the rest of their life. As mentioned earlier, the underlying cause for the eyelid ptosis and other factors affect the predictability and longevity of any ptosis procedure. Eyelid ptosis is classified as either congenital, meaning you were born with this condition, or acquired, meaning the ptosis occurred after you were born. The type of ptosis surgery that is performed is based on the eyelid position and the function of the muscle which lifts the eyelid, and this muscle is called the levator muscle. Word levator is like the word elevator without the letter E at the beginning. If someone has congenital ptosis, this means that the levator muscle did not fully develop. The muscle may not contract as strongly, nor will it relax or stretch like a normal muscle. Imagine you can't extend your arm fully because your bicep can't relax completely, nor can it flex your arm fully because your bicep muscle is underdeveloped. The goal of a ptosis procedure is to lift the upper eyelid to a height and contour which improves appearance and vision while still allowing the eyelid to close adequately for proper eye protection and lubrication. Understanding the underlying issue with congenital ptosis is what makes the management of congenital ptosis challenging. For example, a procedure for congenital ptosis is called a levator muscle resection. In this procedure, the levator muscle is shortened so the eyelid can be elevated. However, since the levator muscle doesn't relax or stretch like a normally developed muscle, the eye may not close as well after surgery. This means that although a patient may look good during surgery and initially after surgery, the eyelid can drift lower than it was initially as the tissue stretches to allow for eye protection with normal or forced blinking. Another procedure for congenital ptosis is called a frontalis sling. In this procedure, the muscle which lifts the eyebrows, called the frontalis muscle, is connected to the eyelid margin so your eyes open by you lifting your eyebrows. I perform this procedure when someone has moderate to severe ptosis with minimal to no levator muscle function. In this situation, the tissue can stretch with blinking and changes occur over time with facial aging, thus requiring additional surgery later on. Although there are neurologic causes for ptosis, the most common cause for ptosis is called involutional ptosis, which is essentially the tendon of the levator muscle called the levator aponeurosis becoming thinner or detaching from the structure called the tarsus. Generally, people with involutional ptosis have good muscle function, and correction can be performed successfully with long-term stability. I routinely perform ptosis surgery from the underside of the eyelid. A muscle called Mueller's muscle is behind the levator muscle, and for people who have mild to moderate ptosis with good levator muscle function, I'm able to get consistently good results. Even with a successfully executed procedure, revision surgery may be needed for undercorrection or overcorrection. I know I can speak for any experienced oculoplastic surgeon that ptosis surgery can be very challenging to achieve satisfactory results regardless of the surgeon's technical expertise. I would go so far as to say that it's a reflection of an oculoplastic surgeon's real-world experience to acknowledge just how complex ptosis surgery can become. It's no wonder that no other surgical specialty is trying to compete for these procedures. During my consultation, depending on the type of surgery I'm planning to perform, I explain to my patient the variables which can affect the outcome of the proposed procedure and that there may be a need for a plan B during surgery as well as a need for revision after surgery. I actually have my patients sit up during surgery so I can make adjustments to improve the likelihood of a successful outcome. Although eyelid ptosis correction surgery can improve your appearance affected by aging, it cannot stop the progressive effects of aging on the eyelids and the surrounding facial areas. In addition, for age-related ptosis, the tendon of the levator muscle can continue to become thinner or detach, requiring additional surgery. I routinely perform ptosis correction surgery under local anesthesia with light IV sedation. In addition to being able to make fine adjustments with my patients sitting up, avoiding the risks and recovery from general anesthesia, in my experience, is optimal for my patients. If I place skin sutures, I remove them in about 5 to 7 days. My ptosis surgery patients usually return to work in about a week after surgery. In spite of some complexity, the results of ptosis correction surgery can last for years. Depending on the cause of your ptosis and the strength of the levator muscle and other eye-related anatomic and functional factors, the predictability and need for additional procedures is part of the risks of having this type of surgery. It's important that you have a proper examination and enough time during your consultation to understand the risks that apply to your specific ptosis condition. I hope you found this information helpful. Thank you for your question.